Winstrol. Stanozolol, commonly known as Winstrol, is an anabolic steroid derived from dihydrotestosterone. It was designed to boost strength and speed without adding excess mass, making it popular among fighters who rely on explosiveness and agility. It increases protein synthesis and reduces water retention, giving the muscles a dry, defined look. But the same compound is notorious for liver toxicity, joint pain, and severe cholesterol imbalance, side effects that make the body stronger and weaker at the same time. It's also one of the easiest steroids to detect. Even microgram traces can stay in the system for weeks. Fighters like Yoel Romero and Mirko Cro Cop have both tested positive. Winstrol is banned because it provides fast, visible performance gains at the cost of long-term health and fair competition. Equipoise. Boldenone, marketed as Equipoise, was originally developed as a veterinary steroid for horses, designed to boost stamina and appetite during recovery. In MMA, it's used for the same reasons: steady muscle gains, faster healing, and dramatically improved endurance. It increases red blood cell production, allowing more oxygen to reach the muscles, a clear advantage in long, grinding fights. The effect mimics high-altitude training, but through chemistry instead of conditioning. Its downfall is its half-life. Boldenone metabolites can remain detectable for over a year, catching fighters months after use. That's why the UFC bans it. It turns endurance into a pharmacological weapon that outlasts the athlete who used it. Turinabol. Turinabol, or dihydrochlormethyltestosterone, was developed in East Germany's Cold War doping program to create stronger, faster athletes without obvious bulk. It boosts protein synthesis and muscle density while minimizing water retention, perfect for fighters who need strength without weight gain. But the same chemical precision comes at a cost. Turinabol suppresses natural testosterone, damages the liver, and can elevate cholesterol and blood pressure over time. It's also one of the most traceable steroids ever made. Modern testing can find its metabolites months after use. Fighters like John Jones and Frank Mir have both tested positive for it. Turinabol is banned because it delivers performance far beyond human limits, and the body always pays for it later. Decadurabolin. Nandrolone, or decadurabolin, is one of the oldest anabolic steroids. It boosts protein synthesis, strengthens joints, and speeds recovery, making it popular with older fighters and those coming off injuries. But it comes with serious downsides: hormonal shutdown, water retention, heart strain, and sexual dysfunction from suppressed testosterone. Its metabolites also linger for over a year, making it one of the easiest drugs to detect. Fighters like Anderson Silva and TJ Grant have tested positive for it. Nandrolone is banned because it turns recovery into an unfair biological advantage that lasts for months. Anavar. Oxandrolone, known as Anavar, is an oral steroid originally developed for patients recovering from surgery or severe muscle loss. In combat sports, it's prized for promoting lean muscle retention and strength without significant weight gain. Anavar is popular among fighters as it can be ingested orally and doesn't require the harshness of injections. It boosts protein synthesis and fat metabolism, making it popular during cutting phases. But despite its mild reputation, it still suppresses natural testosterone, raises liver enzymes, and negatively affects cholesterol levels. Fighters like James Krause and several women's division athletes have tested positive for it. Anavar is banned because it blurs the line between recovery aid and enhancement, giving clean fighters no chance to keep up. Testosterone. Testosterone is the body's core anabolic hormone, responsible for muscle growth, strength, and recovery. In MMA, synthetic versions like cypionate or enanthate let fighters train longer, heal faster, and hit harder. It boosts protein synthesis and red blood cell production, giving endurance and power beyond natural limits. But anti-doping labs track the testosterone to epi-testosterone ratio, and when that balance spikes, it proves external use. Fighters like John Jones, I know, he's on the list a lot, and Chael Sonnen have tested positive for it. The UFC bans testosterone because once it's synthetic, it stops being biology and starts being chemistry. Trenbolone. Trenbolone, otherwise known as TREN, is one of the most powerful anabolic steroids ever created, originally designed for livestock to increase muscle growth and appetite. In bodybuilding, it's known as the hardening compound, famous for extreme strength gains, vascularity, and rapid fat loss. In MMA, some fighters turn to TREN for the same reasons: explosive power, aggression, and faster recovery between fights. But the trade-off is brutal. It causes severe hormonal suppression, insomnia, night sweats, and cardiovascular stress, often leaving users mentally volatile and physically exhausted once the cycle ends. Trenbolone is banned because it transforms the body far beyond human limits, but always leaves it worse on the way back down. SARMs. SARMs, or selective androgen receptor modulators, were designed as experimental drugs to treat muscle wasting and osteoporosis. They mimic the effects of steroids by binding to muscle and bone receptors, but without converting converting to estrogen or causing as much water retention. In bodybuilding and MMA, they're marketed as safe steroids, used to build lean muscle and cut fat while claiming fewer side effects. But that label is misleading. SARMs still suppress natural testosterone, disrupt hormones, and can elevate liver enzymes. USADA detects them in microscopic doses. Even trace contamination in supplements can cause a positive test. Fighters like Sean O'Malley and Amanda Ribas have both been caught this way. SARMs are banned because they promise clean gains, but they're just steroids in disguise. Clenbuterol. Clenbuterol isn't a steroid. It's a bronchodilator, originally prescribed for asthma. In the fitness world, it's abused as a cutting drug because it increases metabolism, burns fat, and slightly boosts endurance by improving oxygen uptake. It's usually taken in tablet or liquid form, though some athletes use inhalers for faster absorption. CLEN stimulates the nervous system, raising body temperature and heart rate, which also makes it dangerous. Side effects include tremors, anxiety, and heart palpitations. It's banned in the UFC, yet one of the strangest moments in MMA came in 2019 when Greg Hardy used an asthma inhaler between rounds and claimed it was USADA approved. It wasn't. The fight was overturned to a no contest. Clenbuterol is banned because it turns your lungs into an unfair engine, one breath away from a violation. Dianabol. Metendienone, or Dianabol, is one of the first true anabolic steroids, developed in the 1950s to boost recovery and muscle growth in athletes. It became a staple in bodybuilding for rapid size and strength gains, and some MMA fighters turned to it for the same reason: short bursts of power and mass before a fight camp. But it's extremely detectable and toxic. Dianabol elevates liver enzymes, spikes estrogen, and completely shuts down natural testosterone. Former UFC light heavyweight Stephan Bonnar famously tested positive for Dianabol after his rematch with Anderson Silva in 2012, a result that ended his UFC career. Dianabol is banned because it delivers undeniable power, but no athlete walks away clean. Methyltestosterone. Methyltestosterone is one of the oldest oral steroids, a fast-acting synthetic form of testosterone. Fighters have used it as a short-term boost before competition, often taken in pill form during the final weeks of a camp, or even in the last few days leading into a fight. The goal is to spike aggression, strength, and recovery right before performance. Because it's methylated for oral use, it hits the bloodstream quickly but also puts heavy stress on the liver. It can cause mood swings, high blood pressure, and complete testosterone shutdown after just a short cycle. It's easily detectable and banned across all combat sports. Methyltestosterone offers a brief hormonal edge, but one that leaves lasting damage once the fight is over. Anadrol. Oxymethylone, known as Anadrol, is one of the most potent oral steroids ever made. Originally created to treat anemia, it rapidly increases red blood cell count and muscle volume, giving users massive strength and power in a matter of weeks. In bodybuilding and MMA circles, it's often taken at the start of a cycle, sometimes in the first 4 to 6 weeks, to trigger fast gains before switching to milder compounds. But it comes with heavy costs: severe liver toxicity, headaches, bloating, and extreme suppression of natural testosterone. It's easily detected in modern testing, and its side effects often outweigh its benefits. Anadrol is banned because it turns the body into a temporary powerhouse and then breaks it down just as fast. Proviron. Masteron, better known as Proviron, is an oral androgen that doesn't build much muscle on its own, but it's often used to enhance other steroids. In bodybuilding and MMA cycles, fighters typically add it near the end of a stack to increase hardness, libido, and free testosterone, while reducing estrogen-related side effects like water retention. Proviron binds to sex hormone-binding globulin, freeing up more active testosterone in the bloodstream. But it also suppresses natural production, disturbs cholesterol balance, and can strain the liver when abused. It's banned because it acts as a silent enhancer, offering hormonal sharpness and cosmetic advantages that clean athletes can't match. Masteron. Drostanolone, commonly known as Masteron, is a DHT-derived steroid originally developed as a breast cancer treatment. In combat sports, it's valued for its ability to harden muscle, reduce water retention, and enhance definition without adding mass. Ideal for fighters who need to make weight and still look strong on fight night. It's often used late in a steroid cycle or during the final weeks before a fight to achieve that dry, sharp physique. But like other androgens, it suppresses natural testosterone, raises LDL cholesterol, and can accelerate hair loss or acne in men prone to it. Masteron is banned because it fine-tunes performance and appearance at a chemical level, a finishing tool that gives enhanced fighters a visual and physical edge. MENT. Testosterone, known as MENT, is a next-generation synthetic steroid that's far stronger than testosterone. It's typically injected as a fast-acting acetate, used in short cycles before fight camps to spike strength, aggression, and recovery. Even small doses can produce rapid size and power gains, which is why it's been quietly circulating in bodybuilding and underground MMA circles. Originally researched as a male contraceptive, MENT completely shuts down natural testosterone production and often causes severe hormonal crashes once stopped. Side effects include mood swings, high blood pressure, and cardiovascular stress. No major UFC fighter has been caught using it yet, but it's fully banned under the same category as other anabolic agents.